Good afternoon. I call to order today's meeting of the California State Assembly Health Committee. And a couple of quick announcements before we get started on today's agenda. First, as far as time limits, we will hear 2 witnesses per side with a time limit of 3 minutes each. Additional witnesses will please state only their name and organization for the record and their position on the measure. On our consent calendar today, we have no bills proposed for consent. We have 1 item removed from today's agenda. That's item 6, AB 927, Mr. McCarty. That bill has been removed from today's hearing at the request of the author. And a comment, because today we have a couple of bills that have had prior hearings. We have a few bills up today that have previously been heard with extensive testimony and discussion at that time, or those times. And while I always encourage members of the committee to ask questions, in the interests of time today, I'm asking fellow members to limit comments and discussion to new issues that have not already been discussed in previous hearings. And with that, we're ready to get moving along our agenda, and we can start with item number, we'll go with item number 1, Mr. Mainshine, AB 168. No reason to go yet, right?
Move the bill.
I would respectfully request an aye vote.
We don't have a quorum yet, so we can't take a vote on the motion. We can't take a motion yet either, right? We will have to entertain a motion after we have a quorum. So if you'd like to present, please do. If you're satisfied with your presentation thus far, you can end there.
I think my presentation was pretty outstanding, so I will
As do I.
leave it with that and request an aye vote. Thank you.
Fantastic. Do we have any other offers? Okay, we have Ms. Garcia. Oh, sorry.
Linda Way with Western Center on Law and Poverty in Support.
Thank you. You got it. See it for, are there any other witnesses in support of AB 168? Seeing none. Any opposition? Seeing none. Okay, thank you. And when we have a quorum, we can entertain a motion. So we're going now to item number 3, AB 508, Assemblymember Garcia.
Thank you, Chairman and members. I want to start by thanking the committee and staff for giving thoughtful attention to this bill. I accept the minor technical amendments that we are passing along to the Appropriations Committee. In early 2010, the Center for Investigative Reporting published an article that referenced a report by the California Maternal Quality Care Collaborative. This report showed the mortality rate of California women who died from causes directly related to pregnancy had tripled in the previous decade. While the numbers of deaths were relatively small, the report showed it was more dangerous to give birth in California than in Bosnia or Kuwait. There were a variety of factors that led doctors to these findings. Obesity in expectant mothers and the rise of cesarean section deliveries were among the top concerns. Thankfully, today in 2006, the number of women who lose their lives to maternal morbidity are declining, in part because of greater hemorrhaging protocols and coordination between all who deliver services. But there's work to be done. AB 508 would require the Department of Public Health to prepare and publish an annual report on California's maternal morbidity and mortality. I respectfully ask for an aye vote. With me today, I have Dr. Elliot Main with the California Maternal Quality Care Collaborative.
Witnesses in support.
Good morning, committee member, or good afternoon. I'm a obstetrician, a clinical professor at both Stanford and UCSF, and for the last 10 years have been the lead for the California Maternal Quality Care Collaborative. The collaborative is a collection and an active participation of all the organizations in California interested in maternal health, which includes professional societies like ACOG, the Nursing Association, and the Midwife Association, together with the hospital associations, Department of Public Health, the Department of Healthcare Services, purchasers, and payers. So all have significant parts to play in our efforts. We were quite successful in our first project starting 10 years ago with the reduction of early elective deliveries. What we're going to talk about today is the efforts that we've had for addressing, for collecting the data and then addressing maternal mortality. As you see in the graph on the right here, maternal mortality in California has risen in parallel to the United States. Both the U.S. and the United States have risen just in that last 6 or 7 year period, doubled, even higher from before. We started in 2006 with the Department of Public Health identifying the issue and informing a review committee and then action. And what we'll see here is the changes that have happened since then, where the California is in blue and the U.S. is in red, and you can see the U.S. has continued to rise each and every year, where we have gone down. The goal here is to be at 6 or 7, which is the same rate as France, England, and Germany, which is the target of the United States. We have achieved that in California through a public-private partnership between the organizations I mentioned and CDPH and Department of Healthcare Services. This is really taken about by a collective action, by developing and instituting hemorrhage toolkits or protocols, preeclampsia or hypertension protocols, and getting those installed in every hospital in California. Quality improvement, though, as you may be aware, is basically constant gardening. You have to pay attention, you have to keep at it. The purpose of this bill is to institutionalize the reporting, the transparency of maternal mortality rates and maternal morbidity. Maternal complication, major complications happen 100 times more often than a death, and we need to be able to report those back to you all and to our constituencies within California. Additionally, a focus this year is on African American maternal mortality, which is 3 to 4 times that of whites or every other group. So we respectfully would like you to consider supporting this, which is basically a continuation of what we are doing under Title V monies from the federal government. Thank you.
Thank you. Additional witnesses in support?
Shannon Smith Crowley, representing the American Congress of Obstetricians and Gynecologists for California. We are a sponsor of the bill, and we're a heavy participant in CMQCC. And these numbers are absolutely remarkable. Very little monies have been used. Again, some federal Title V monies that have come through Department of Public Health. And all that have been participating in this really deserve a big round of applause for these efforts. This is dramatic in medicine to make this kind of change in this kind of time period. So we're basically asking for just support through this bill of some other data points to help us be able to continue these amazing efforts and get us down to, well, pregnancy, you will have some deaths that are not preventable. A significant portion are, and we'd like to get it down to so there's no preventable death. Thank you.
Do we have any witnesses in opposition? Seeing none, do we have any questions or from members of the committee? Ms. Waldron.
Thank you, Mr. Chairman. I was surprised, I'm happily surprised about your bill, but I was surprised that they had not already been assessing some of these things, and I was just wondering, because of that dramatic decline, which is positive, there had been an outreach effort for more education on prenatal care and, how that kind of intertwines with those results, or if they do. And also you had mentioned about reporting on the complications, because those things are important to be assessed, as they might lead to death in individuals, who maybe are not aware of the importance of it. So,
If you don't mind, I'm going to let the doctor answer this for us, as he knows more than I do.
We paid particular attention to the availability of prenatal care and the actual access to prenatal care. California is blessed by universal prenatal care. We are very fortunate in this state, unlike others. Most all the deaths that we saw had some or full prenatal care. That was not the issue in most of the deaths we saw over this time period of 2002 to 2008. We are still actually some 5 years behind in our review of maternal deaths, and that's one of the reasons that we really want to emphasize the need for ongoing reviews to make certain that things aren't changing. Maternal morbidities or major complications, what we also call as near misses, are a very important part of this process because they, again, occur 100 times more common than the deaths, and they are right on that pathway.
Other comments or questions from members? Ms. Burke.
I just really wanted to thank you. This is an issue that plagues African American communities in a horrific way. So I just really want to thank you so much. We've discussed this in Black Caucus, and it really is an important issue to us. So thank you for bringing this bill.
Other questions or comments from members? We can entertain a motion. We cannot entertain a motion. I'm sorry. Just making sure everyone's paying attention that we don't have a quorum. Ms. Garcia, would you like to close?
I respectfully ask for your aye vote to help California continue to be a leader in this area. And we welcome co-authorships along the way, so contact our office. Thank you.
Thank you as well. We'll take this up for motion and a vote when we have a quorum. Okay, we're one short. Okay. We'll go to item number 5, AB 911, Mr. Bro. Okay, and as Mr. Bro comes up, noticing a quorum, Madam Secretary, please call the roll.
Here you go. Bonta?
Here.
Mainshine? Here. Bonilla? Burke? Chavez? Chu? Gomez? Here. Gonzalez? Hernandez? Lackey? I'm here. Nazarian? Patterson? Ridley Thomas? Rodriguez?